Hi everyone, this is Dr. Chaitra from Kalpa Clinic. Today we'll be discussing about an important topic. We are going to discuss about reasons for painful period. So commonly there are 4 important reasons for painful period. The first one would be physiological or due to natural causes. Normally when a girl ovulates or releases her egg around the mid-cycle, say normally if you have 28 days cycle, it should be on the 14th day of the cycle, her uterus prepares for a pregnancy. When the periods start, the uterus realizes that there is no pregnancy going to happen and it wants to release or it wants to just push out whatever was the lining that is there. And that's why quite often women do have painful periods, especially on the first or the second day of the periods. What is the second important reason for having painful periods? The second important reason would be some issues or some abnormalities in the uterus. The most common place where there is an abnormality or tumor in the uterus would be a fibroid or commonly known as a myoma. So depending on where the myoma or the fibroid is located and how many of them are there. Suppose it's a large fibroid, it is close to the lining of the uterus, always you'll have more symptoms as in very painful periods, heavy periods, and you'll be very tired at the end of the periods. If it is a fibroid which is just outside near the surface of the uterus, then the symptoms may be less, or even quite often you may not even have a symptom and you will incidentally find that you have a fibroid when you go for a scan or when you have had a cesarean section or something of that sort. What is the third important reason why you have a painful period? Suppose you have bleeding into both the uterus and into the ovaries. That means the period which was supposed to go out through the cervix into the vagina sometimes takes the opposite route, goes into the tube and into the abdomen or into the ovaries even. Then this condition where you have very painful, severely painful periods which require even hospitalization or medications is known as endometriosis. If you have periods which are increasing and which become very bad, the severity of the pain becomes very bad each cycle, then please do visit your doctor to find out if you have something called as endometriosis. This usually can be seen on the scan as cysts, or when you do a laparoscopy, you may be able to pick out a few drops or few spots in the uterus or the abdomen. The fourth important reason why you have a painful period is if you have taken any other, intrauterine contraceptives, like commonly copper T. Now it's not very common, but women who used to put in copper T to avoid a pregnancy, they used to complain of very severe, very painful periods which would have spasms. So do check out if you have any painful period, if you have any of those causes, or if you feel that it's a very painful period which you can't manage with just a few medications or painkillers, do visit your doctor to find out if you have any reason to worry. Cheers.